So when you have knee replacement or any surgery for that matter, you're going to have a scar. And many patients get hypersensitive scars or they worry about the appearance of the scar, or sometimes the scar gets sticky. And patients wonder always how to treat those things. So in today's video, I'm going to go over all of the ways that I tell my patients to treat those particular scar problems. So stay tuned. Hi, and welcome back. If you haven't already liked and subscribed, please do so, and it helps people like you find this channel. In today's video, I'm going to talk to you about the scar. So when you have a knee replacement, or any surgery for that matter, you're going to have a scar. And the first thing that people ask about commonly is, what can they do to the scar? How do they treat the scar? How can they make the scar look as good as possible? Well, first of all, there's two things that you really don't have great control over. So number one is biology. Some patients are prone to form keloids, and that's a wide scar and a raised scar. And if you're a keloid former, there's probably not a whole lot that you can do to control that. The second thing is the actual surgery. So how a surgeon handles the tissue can be a factor in how your scar looks. And we went through this years ago trying to make really tiny incisions. And what we found is that the small incision didn't necessarily lead to less pain. But because we had to stretch the tissue, a lot of those scars wound up looking wider or more pronounced, and people could notice them more, even though the length of the scar was smaller. But in any event, once you have a scar, and once it's essentially healed or matured, because we don't want you rubbing it in those first couple weeks when it's actually healing, there are some things that you can do to make the scar more minimal. Now, years ago, I actually asked who I believe would be the experts when it comes to scars, what they do, and that was our plastic surgeons. And what most of them had their patients do is buy the vitamin E capsules and poke a little hole, and they would squeeze that vitamin E liquid over the scar and then push and rub up and down, little circles side to side to help flatten the scar and make the scar look more appealing. Now, I've had a lot of patients use other things. So one of the things that I recommend sometimes is cocoa butter, which works really, really good, especially if you have a dry scar. This can really help moisturize the skin over the scar and can help make that scar look less pronounced. Some patients also use aloe, especially here in Southern California. A lot of patients have natural aloe plants on their property, and they can just break off a leaf. Or you can buy aloe in a bottle and use that on the scar. Now, there's a number of other things that people have used. I mean, simple things like Vaseline and mineral oil, and there's a number of over-the-counter products. Many of them are either gels or tapes or coverings that you can put over the scar that help minimize the appearance of the scar. But what works for you and what works for the next person may differ. So at least here are some options that you can use to treat your scar to make it look as minimal as possible. Now, the next thing I want to talk about is how to desensitize the scar. Now, some patients, for whatever reason, we don't always know why, develop a hypersensitive scar. When we cut through the skin, we are cutting through skin nerves that we can't see with the human eye. And sometimes those nerves become hypersensitive. People will say, like, it hurts when my pants touch it. It hurts when the sheets touch it. And there's not a whole lot that they can do to magically make that go away. But the important thing is you have to do something. Otherwise, that hypersensitivity will persist. So the first thing I tell patients is you have to touch it. Even if it hurts, you have to put your finger on it and touch it to desensitize the scar. And if it hurts, one of the first things I recommend my patients do is ice it. So if you put ice on your knee for a while and you basically freeze the skin, it's less sensitive. And then once it's cold, you can remove the ice and take your thumb or your finger and push and rub and push and rub and push and rub. That usually helps a lot. The next thing that some of my patients have found to be helpful, especially those that have difficulty sleeping because the sheets touch it, is some of the over-the-counter creams that cause tingling and burning, essentially. A lot of the products that have capsaicin in it So you can buy capsaicin. It's a liquid, a gel product that you can buy. Tiger Balm's another one. Icy Hot's another one. So you can actually rub that on the scar. For some people, it can be a little overwhelming if they do it too early. But once you've broken in the scar and started to desensitize it, sometimes that tingling and that burning sensation can start to help desensitize the nerves. One of the last things that I have patients do is, like, once they're able to sort of treat it with their finger, but it's still a little sensitive, is actually just picking up a new fresh toothbrush. And you can use the bristles and rub them up and down and side to side on the scar. And again, it's another way of desensitizing the scar. The last thing that I want to share with you is what's called scar mobilization. So in our body, there are tissue planes. So when we talk about the knee, there's the skin, and then there's layers of tissue underneath that. And if you look at your normal knee, you'll see that that skin, moves back and forth very normally. And when we do surgery and make an incision, sometimes that skin gets stuck and it doesn't move back and forth at all. It can cause pain. It can sometimes make it difficult when people are trying to regain range of motion. So once the scar is healed and it's mature, I always show my patients how to mobilize the scar. Now, a couple simple ways. One is using your fingers, and you can do one of two things, sometimes both. Is basically where the scar is, put your fingers on either side and rub it up and down, and then move your fingers up like a half an inch and rub it up and down. And what you'll find initially is the scar doesn't move very much. It's very stuck. And if you keep playing with it a couple times a day, day after day after day, you'll start to see that skin on top become looser and glide over the tissue below it. The other thing that you can do is side-to-side motion. So basically either on the scar, just to the edge of the scar, pushing your thumbs side to side, and again, working your way up and down the scar. And that can really help mobilize that scar and break up any adhesions that have formed underneath your skin. Now, two other techniques that I found to be helpful. This is a great product. It's made by the Wave Tool Company. They're a bunch of physical therapists, and they're also rock climbers. And they're really used to dealing with soft tissue injuries. And it has, different corners that you can use. But what patients can do is actually use this and scrape the scar. So instead of using their finger, they can actually scrape the scar and the tissue. And I tell patients, like, this has to be done once the scar is mature. But by scraping that tissue, a lot of times they can mobilize that skin and mobilize the scar. One other technique that works pretty well is using cups. So this is also made by the same company, but you can find cups a lot of different places. And what you can actually do is use the cup and put it on one side and the other side of the scar. And again, up and down, up and down, up and down. Or sometimes you can actually put it on the scar itself and glide up and down, and you're basically trying to raise it. And in doing so, again, you're taking the skin and trying to detach it from that scar tissue that's formed underneath it and make that skin more mobile. And the goal essentially is to look at the normal skin on your thigh or your shin and seeing how mobile that is, and then seeing how tight the scar is just in front of your knee and trying to break that up so it moves as easily as the skin and tissue above and below where the scar is. So I hope you've found this information helpful. A lot of patients do have these questions, and at least this gives you some guidelines on how to treat your scar after surgery, to desensitize it, to make it look as good as possible, and to mobilize the tissue so it can move as freely as possible and get back to being close to normal. Thanks again for watching. Until next time, I'm Adam Rosen. Stay safe.